How is PAP titration done? If you are curious about how positive airway pressure titration is performed, you are in the right place. This process is essential for treating obstructive sleep apnea. It helps determine the best air pressure settings for devices like continuous positive airway pressure or bilevel positive airway pressure machines. The journey begins after a patient is diagnosed with obstructive sleep apnea. Before the titration, the patient receives education about the therapy. This includes a hands-on demonstration of the equipment and fitting of the mask. Comfort is key, as a good fit helps prevent air leaks and improves tolerance during the study. The titration typically takes place during an overnight sleep study called polysomnography in a specialized sleep center. During this study, the patient wears a nasal or full-face mask connected to the positive airway pressure machine. A trained sleep technologist monitors the patient throughout the night. The process starts with a minimum air pressure of 4 centimeters of water. The technologist gradually increases the pressure as needed. The goal is to find the right level that keeps the upper airway open. This prevents obstructive respiratory events, which include pauses in breathing, shallow breathing, and snoring. For continuous positive airway pressure, a single fixed pressure is determined. For bilevel positive airway pressure, 2 pressures are set: inspiratory positive airway pressure and expiratory positive airway pressure. The aim is to eliminate obstructive events without causing discomfort. The sleep technologist makes real-time adjustments to the pressure based on the patient's sleep and breathing patterns. The optimal pressure is the lowest setting that effectively prevents airway collapse during all sleep stages and positions. Once the ideal pressure settings are identified, these settings are prescribed for the patient's nightly use at home. Proper mask fitting and continued education remains important after titration. This ensures that patients can comfortably adhere to their positive airway pressure therapy. In essence, positive airway pressure titration is a carefully monitored process. It is performed during a sleep study to adjust air pressure levels. This helps maintain an open airway and eliminates breathing disruptions caused by sleep apnea. By following this process, patients can receive effective treatment tailored to their needs.